I've heard of the London School of Hygiene and Tropical Medicine throughout my undergraduate degree, but also in high school, and I always thought it would be an amazing privilege to be able to study here one day, but never thought that that would, come into fruition. And so, from when I got accepted into the school and now we're here graduating, it's pretty surreal. I think what was attractive about the Masters in Global Health Policy is that it really developed the conceptual thinking and the way that you approach different situations, different global issues. I found doing it by distance learning really helpful for the work that I was doing alongside my degree. So I was working in food systems policy and research, and I was doing a lot of work in the sort of international population nutrition space. The beauty of the distance learning program was that it was very flexible, so you had the ability to tune up or tune down when you did your different assignments or when you did your exams. You can do the program over a space of 5 years. I personally took 3 years to do it, and so I was able to do it full time for the first year and the third year, and then in the second year I pulled back and as my work picked up a wee bit. Having that flexible learning and also the more independent way of learning really helpful in terms of being able to work full time for parts of the degree, and being able to connect with people around the world as well. There's a real sort of global network within the distance learning programs, and so I was able to live in a few places overseas while doing this degree, and so being able to connect with people in different cities was a real privilege. What I really enjoyed about the course is that you have your 4 core modules that you do, and that really creates that foundation in global health policies. But then you have several other elective modules, and so you get to change up and switch around based on what what your interests are or the sort of direction you want to take the degree in. So you get an opportunity in your final year to do a research project, so it's like a sort of mini dissertation, and I was able to steer that towards food systems policy, and I found just the way that complemented the work and space that I find myself in now, is quite a benefit to the degree. So that was definitely a highlight. So if you're someone who has an interest in, understanding how systems work and how, various actors interact, the beauty of the degree is that it, you go macro and look at things as a whole, but as you're writing your assignments, you might do something that's more local, but draw out, how does global health policy interact with that? And so being able to have that nice balance, I definitely recommend if that was something that you were interested in.